Welcome to the Rock Newman Show.
It's the Rock Newman Show.
And now, the Rock Newman Show.
Folks, welcome back to the Rock Newman Show. We're at the Langston Hughes Room at Busboys and Poets, broadcasting live. In studio with me now, we want to talk primarily in this segment about Washington, D.C. healthcare. And it stands to reason that you could extrapolate that Washington, D.C. healthcare is a microcosm of healthcare, the concerns, the issues, the challenges, the benefits, literally throughout the country. And Dr. Jehan El-Bayoumi is a professor, is an internist at George Washington University. She is world-renowned. She has treated some of the top individuals in the world. She has been the family doctor, interestingly enough, for politicians from both sides of the aisle. And when I say politicians, I'm not just talking about low-ranking folks. I'm talking about presidents and vice presidents and secretaries of defense and on and on and on. Her practice, her professionalism is something that those in the greatest of power, it has allowed those in the greatest of power to trust her to put themselves in her care for their physical well-being. She is the founding director of the Rodham Institute, which is named after Hillary Clinton's mother. And Dr. El-Bayoumi has been the family doctor for the Clintons, and now let's go right over the other side of the aisle, for Dick Cheney. And there is something to be said just about that. In this town that has become so incredibly divided, that there is an individual that these power brokers trust, no matter which side of the aisle says something for that individual's competence and professionalism. Dr. El-Bayoumi, welcome to the Rock Newman Show.
Thank you. Good morning.
God bless you, and it's great to have you.
It's my pleasure, Rock. First of all, let me just say a disclaimer. It's not about me being so wonderful and taking care of both sides of the aisle. Any professional, any clinician takes care of all VIPs, whether they're homeless or whether they are president of any country or foreign state. So I appreciate the compliments, but really this is the oath that I took as a professional and as a physician, and I dare say that all my colleagues, especially at GW, take care of people on both sides of the aisle, and the politics, and I have strongly held views, are separate than the care that we have when we're one-on-one in that room. I don't care what your politics are. You are the human being that I, as the physician, takes care of.
You know, and that sounds very much like I had Dr. Ben Carson on, and we all know the world-renowned Ben Carson, and he said something similar, man. When he opens it up, all the rest of that superficial crap just goes out the window. And, in fairness, it should be said that I just talked about names that people would recognize.
Sure.
But those unnamed and those without a voice, it has also been demonstrated by your commitment to them, sort of the humanity that you bring to your profession. And the fact that you are applauded and honored has much to do with that particular humanity. So,
well, thank you. And I would say this, that there are a lot of other people like me in this city, good people, good organizations. And since you introduced the Rodham Institute, that's actually one of the main goals of the Rodham Institute. We are much stronger together than we are apart. And one of the the missions and part of the vision and the goal of the Institute is to work together synergistically, cover each other's weaknesses so we can uplift everybody. And let me tell you a little bit about Mrs. Dorothy Rodham, who was my patient. She died
Dorothy Rodham, Hillary Clinton's mom.
Right.
Yes.
She died November 1st, 2011 at the age of 92 and a half. And I'm not outing her in any way when I tell this story, she came from a difficult circumstance. She was extremely bright, and in a different circumstance, she would have been a doctor. She loved learning and education, and indeed, when she had the opportunity, she audited classes at the University of Arkansas, where her son-in-law was governor. And she had a commitment to social justice, and not in words only, but indeed, when she would come to see me as a patient, she would sit in the waiting room just like anybody else, polite, kind, talk to everybody, down to earth. And so to honor her and to honor her legacy, it was important to me, especially being of Egyptian heritage. You know, you want to honor your ancestors.
Absolutely.
How you remember people is very important. I wanted to do something that would bring her commitment to social justice and her love of medicine and healthcare together. So the Rodham Institute is an action-oriented institute to reduce health disparities, not overseas, not in exotic Africa, but right here in Washington, D.C.
Yes.
Because although I was born in Florida, raised in Michigan, I've been in Washington, D.C. now. I'm about to start my 29th year here. I chose Washington, D.C.
Your 29th year, so you came here really as a baby.
Something like that. I chose to come to D.C. I fell in love with it. I knew and I fell in love with Chocolate City. And what struck me, taking care of people in those high positions, as you mentioned, is the lack of knowledge, the lack of commitment to making a change. People were coming through, especially at the federal government level, coming through here, enjoying the generosity of Washingtonians, but there was no reciprocity. So it was really important to me when you love something, you want to serve it. Yeah. I want to serve Washington, D.C. And as a doctor, the best way that I could think of serving it is to be part of the solution of reducing the Great Divide. Because let me quote some statistics for you, and you will be shocked.
Yeah.
We are really, you might not be so shocked, we are really a tale of two cities.
Yes.
East of the river, we have the same rates of HIV that any developing country in Africa has. DC is number one in a number of areas and not in good ways. Number one HIV per capita in the country. Number one cancer death per capita in the country. Number one end-stage renal disease.
And what kind of disease?
End-stage renal disease, people with kidney failure in the country. And yet, we are in the capital of the richest country in the world. Yeah. That is an embarrassment.
That's the seat of power.
That is an embarrassment.
Yeah.
That is a shame.
Yeah.
And, you know, in the mid-1990s, did you know that our infant mortality rate right here in D.C. was the same as Haiti's?
No, I did not know that, and that is shocking when you just think about it, when you juxtapose one against the other.
And, you know, we just...
The poorest country in this hemisphere, and the richest countries in this hemisphere, the same rate of infant mortality.
So, you know, in the previous hour, my dad spoke about sort of world issues in terms of politics, in terms of money. It is as a result of the prison industrial complex, of the war machine, of the what I call uber capitalism, not regular capitalism, where if you were Henry Ford and you worked for his company back in the day, you as the assembly line worker could afford the car. No, I'm talking about something way beyond that. I'm talking about...
Uber as in obscene. Yeah.
I'm talking about At the end of Clinton's presidency, Bill, that is, the difference between an entry-level worker and a CEO was 40-fold, which was about what Western Europe was, 2030. At the end of the Bush presidency, it was 400-fold. That's what I call Uber capitalism.
Yeah. Yes. Yes.
And health is just a manifestation of poverty. We're talking about poverty. I want to just say, in commemoration of the Reverend Dr. Martin Luther King Jr.'s 50-year anniversary of I Have a Dream speech, what gets left out in the discourse and the discussion, he was anti-war. He was anti-poverty.
Yeah. Yeah.
He did not look at equality as just simply being a superficial. He had a greater vision of a holistic equality.
And so far from just being a dreamer, but a very real activist, a very real proactive organizer to help bring effect and change to those issues that concerned him.
So one of the things that in medicine, as in many other fields, we learn is that if you're going to solve a problem, you can't just take a piece here and take a piece there and take a third piece here. Sometimes, if you're going to have true lasting change that's long-term, you have to address all the problems simultaneously. So until and unless we address poverty, healthcare will not be solved. Unless we talk about economic equality, then racism will not be erased. As long as we talk, we don't address corporate greed. And by the way, the fastest growing corporation group industry is what? The prison industrial complex.
Prison industrial complex, yes.
So these issues may seem disparate, but especially as a general internist, I don't just focus on the eye or the arm or whatever. You talk about the whole organism, the whole human being. So we are living at a time in human beings' development where we are all connected. And so if we preach war, if we behave in warlike ways, if we feed our kids video games that talk about war and we send young people to create war, what it is a boomerang. Yeah. Look at all the school shootings that are happening.
Yes.
This kid down in, North Carolina, Georgia, Decatur, Georgia, he said, nobody loves me. And it took a black woman to talk him down.
Yeah.
So these may seem like, what is she talking about? She's talking about healthcare, but it's all linked.
Yes, yes. So let me ask you, so much to ask. Would you, with all that you do, you have people's sort of lives in your hand. Would you give us a day in the life of Dr. Jehan El-Bayoumi? Would you just kind of walk us through a typical day, if such thing exists?
Sure. First of all, I love seeing patients, and I guess this speaks to sort of my bicultural background. Before I talk about the typical day, I want to tell you a story about my grandmother.
Okay.
My dad's mom.
Okay.
My dad's mom didn't have a huge formal education, not because her parents didn't want her to, I found out, but because she wanted to hang out with her aunts that had a lot of fun. Was probably one of the smartest human beings that I ever knew. And through her father, learned a lot about medicine and folk medicine, but she was a true healer. And I will never forget when my sister, we would go back and forth between here and Egypt in the summertime, came down with hepatitis A. And, we were away from my parents, and she was, teenager, scared, not feeling very well. So my grandmother took out a newspaper and cut a newspaper in the shape of a paper doll. And she asked my sister, "Who did you see today?" And my sister named everybody, and for every name, she punctured a hole in the paper doll. And she said, "Okay, is that everybody?" She said, "Yes." She lit a match to it, circled my sister's bed 7 times, and my sister happened to fall asleep, and then we stepped out, and I said, you know, Gatito, do you really believe in that stuff? She says, it doesn't matter what I believe, it's what she believes. And she's better, isn't she?
Yeah, yeah.
So healing is something that anybody and everybody can have. Conversely, just because you're a doctor or any clinician doesn't mean that you're a healer.
Mm-hmm.
So, and it's not an individual sport, it's a team sport. So when I go in the morning.
Okay, tell you what.
Tell me.
We came up to the clock.
Okay.
We're gonna take this break and come back and find out about that typical day and more about the Rodham Institute and all that Dr. El-Bayoumi does.
My pleasure.
On the Rock Newman Show at Busboys and Poets.
My baby drives a pro handcuff.
The weekend is here, and no matter what the weather's like outside, you'll find the deals inside here in the beautiful showroom of the all-new Pohanka Hyundai in Capitol Heights during their giant Markdown Madness sale.
Smart shoppers know that every new Hyundai in Pohanka comes with Hyundai Assurance and America's best 10-year, 100,000-mile powertrain warranty. But why don't you tell them about the Markdown sale, Joe?
I'll be happy to, Kim. Folks, shop around on the web, and you'll see lease payments on a new 2013 Elantra GLS at $179 a month. Today at Pohanka Hyundai, $99 a month. That's right, a $99 payment on a brand new Elantra.
And $89 a month on a new 2013 Accent GLS Automatic. How do they do it, Joe?
It must be the volume, Kim. A brand new building, hundreds of new Hyundais, and Pohanka's low payment and easy credit programs are designed to get everybody driving. But you have to get here today. Rush to the giant Markdown Madness sale at exit 13 off the Capitol Beltway.
Pohanka Hyundai, king of the Beltway. All financing for a limited term on approved HMF credit.
My baby drives a pro handcuff.
And now, the Rock Newman Show.
Welcome back, folks. Today is Saturday, August the 31st, 2013, and we're broadcasting live from the Langston Hughes Room at Busboys and Poets. My guest, Dr. Jehan El-Bayoumi, founding director of the Rodham Institute, internist and professor at George Washington University. And before we were forced to go to break by the clock, you were getting ready to give us an example of the day in the life of.
Okay. Well, the first thing is when I see my colleagues and staff at GW, there are a lot of hugs and shout-outs and smiles, because I think that if you're going to be seeing patients in clinic, you have to create an atmosphere which is a healing atmosphere. Mm-hmm. And when people come to see me in the clinic, they're coming to my house.
Yes.
and making sure that they are comfortable, that they're not scared. You know, when you're sick, you're scared. And even if you're not scared per se, you may have the memories of having, like you go to some people are afraid of going to the dentist.
Sure.
A lot of people are afraid of going to the doctors. So we try to create an atmosphere that is comfortable. And so I see patients, and I really get to try to get to know them as individuals, because unless I understand the context of them as individuals, how am I going to be able to be helpful to them?
Right.
So I learn about their families, what do they do for a living, what kind of stress they're going under or going through. And you mentioned it before the break that I have the lives of people in my hands, but that's a big responsibility.
Yeah.
And so it's important that we create a partnership so that it's not such a big burden on me. I'm a human being after all.
Sure.
So to give permission to the people that I'm caring for and saying, look, you tell me, does this sound right to you? Did I miss anything? And sometimes people say, you forgot X, Y, and Z. And I'll thank you for reminding me.
Sure.
And it's not just about the people that are in that room, me and the patient. It is about the nurse, the person greeting the patient at the front desk, the pharmacist that I work with. So the nice thing about where I work is that I love the human beings that I work with. I also teach, and I teach medical students, I teach residents. I work in the hospital as well, and that's where I really get to see the ugly side, the ugly face of the lack of health care and access to good health care. Because you see people who are down and out on their luck and end up being on the streets, who end up dying early. And they use alcohol, they use tobacco, they use drugs, sometimes they use sex as a way of self-soothing from the pain that they are going through. And so when they seek treatment, they're oftentimes at delayed stages in their illness. And the repercussions of what their illness has done on the overall family is really tough. So my day, there is really no typical day because I do a little bit of everything. And of course now with the Rodham Institute, I'm having the great fortune of meeting a lot of good folks all around the city so that we can work on issues that will hopefully make a dent and at least move the needle in terms of reducing disparities.
Okay. So you obviously, as a doctor, you treat patients. You treat patients in a hospital. They come to see you there. You build that bond with them. You really have taken on something now as the founding director of the Rodham Institute, where you're going beyond just your isolated relationship with the patient. I think it will probably go without saying, you still treat one patient at a time. I understand that. But you're doing something, you've taken on a responsibility now. You have a mission and an initiative that is to improve the overall care and access to care of the city of Washington, D.C., across the entire city. How do you go about doing that? What are some of the things that the Institute is doing to make that happen?
Sure. Well, I think I should back up and tell you about what I've learned through being a teacher of students and residents, medical students and residents. I noticed that when a first-year medical student gets into medical school, they're going into medicine for all the right reasons. They want to serve people. They've often done community work. They are excited. And then all of a sudden, they go through the process of medical school and residency training. And that person, the same individual who started off, sometimes is unrecognizable. They serve to objectify people. They refer to patients rather than as people. They'll refer to them as their disease, not their name. So I began to reflect, why is that? What is it about the system? And when we talk about the system as an academician, that's us.
Yes.
What is the culture, what is the message that we've given that allows them to feel that it's okay to behave in that way? So I began to reflect, and I said, you know, poor people, especially in urban academic medical centers in the hospital, trust us with their lives. It's an honor to be able to take care of another human being. And yet what do? We turn around and we objectify them, and when we even do work outside of the hospital, it's charity. Well, I want to say, and I want to make an argument, that it is an obligation that we have not fulfilled and that we have not reciprocated to the people of Washington, D.C. that have entrusted us with their lives when in their hospital. Yeah. So then, what do we need to do? How do we change the educational system in the medical setting to inculcate social accountability, social responsibility? Because we have people that start off that way.
Yes.
So what do we do to nurture and support that? So one of the focuses, there are probably four. One of the spheres that we're really working on is how do we train clinicians? And by clinicians, I don't mean just doctors. Because nurses, community health workers, physician's assistants, nurse practitioners, physical therapists, it's everybody, right?
Anesthesiologists.
Right, everybody. How do we train them in a way that, first of all, they can work as a team together, okay, but also to inculcate that sense of social responsibility? So we began to, with actually the Southeast Tennyson Learning Center under the guidance of Ms. Cora Masters-Berry, look at her program as a model where education of kids through sports is a way to uplift them. So we began to look at the education and look at the whole workforce of getting kids into health professions. So starting with elementary school, middle school, high school, the Rodham Institute is focused on educating in STEM H, science, technology, engineering, math, and H with a capital H, healthcare. So we're doing programs with kids from the Southeast Tennyson Learning Center, Ballou, Coolidge, to educate them on these fields so that as a pipeline, when we're talking about healthcare careers, whether it's nursing or medicine or PA, et cetera, we're getting more minority kids into that pipeline. And then when they're doing their training as clinicians, what do? We say, okay, you medical student or you nursing student, you're going to serve as mentors for these kids.
As what? As
mentors.
As mentors,
So for example, in July 20th, we had a summer enrichment program where the kids that I mentioned from those schools attended, also people from PG County with their parents. We had, think about this, Rock, 18, all African American except one lovely white woman, 18 mentors standing in front of a group of bright-eyed, beautiful kids and their parents, 125 people. I'm a pediatric surgeon. I'm a mathematician. I'm an engineer. How powerful was that?
Yes.
And you want me to tell you it was really powerful? It wasn't just for the kids or the parents, for the mentors themselves. That's how you stay connected. That's how you stay connected. So building the academic community bridge that is bi-directional. So education is key to the Rodham Institute. That's one thing. But it is not just about an individual sport. It is not the cult of personality of Jehan El-Bayoumi creating this. It is bringing together excellent organizations, Southeast Tennyson Learning Center, work that's being done by other people at GW at Eastern High School, Coolidge High School Alumni Association, the Association of Black Cardiologists who provided the curriculum for us to use to teach kids through this health education leadership program, another program where high school kids for 4 weeks, once a week, they come to GW and our residents and medical students teach them about nutrition, tobacco cessation, exercise, and the residents and students put on the workout outfits with the kids.
Yes. Are you getting, are you interfacing with government, with DC government?
Absolutely. So June 8th, we had an introduction and an initiation of a community dialogue with the, I hate to use the word stakeholders, it sounds so corporate, but interested parties. We had DC council members. We had Dr. Christensen, the head of the Black Caucus and Tri-Caucus of Congress, who is the head of the health section, who happens to be an MD alumnus from GW. We had Department of Health folks, Unity Health, AmeriHealth, Whitman Walker, the high schools that I mentioned, Dr. Julianne Malveaux, other people from the community, of course our School of Public Health, Nursing, PA, NP, Medical School, all of that. And we had a 3-hour dialogue where the people there, it was an invited summit, about 85, 90 people, where they told us what the priorities are. And the 2 priorities, education, makes sense, but food issues came up as something important. So we've been working with the different organizations, Wholesome Wave, I'll tell you about in a second, Food and Friends, D.C. Greens, folks from the Department of Health. And, you know, there's been a recent change in the person who's in charge of the Department of Health, but we're continuing to work with them that are not only working with us, but teaching us. There's a mutual education that's happening. We, the Rodham Institute, are going to provide the academic support. So if they want to evaluate their programs, we're here. But they're the ones with the experience, and they have the experience of telling us what works, what doesn't work. We've met with Bibi Otero, Yvette Alexander, Joyce Clement Smith of Marion Barry's office. So we're looking to the wisdom of the community. And you know, everything old is new again. We know how to take care of ourselves. We've just forgotten.
Yeah.
We just need to remember again.
This is such an incredibly, everything I read about it and everything I heard about it is just such a noble thing that's being undertaken. For a train like this to kind of go all through the community, you know, it takes, maybe I should have said car, because what I want to say, it takes gas to put in the tank. How is this funded?
So the reason that I wanted to have it at an academic institute is because there are lots of costs that we don't have to worry about. I don't have to worry about office space or computers or HR or malpractice, right? The university, the institution, is putting some in-kind support. So part of my salary is being supported. We have a grant from Geiger Gibson, another wonderful granting foundation that supported some of the administrative help. The Secretary of State herself has given a gift. But frankly, when she was giving the gift, I said, don't give us too much money, because this has to be about in-kind participation, and money corrupts. So we've got a modest budget. We don't even have enough money to hire an executive director right now, but hopefully we will in the future. But people are giving of their time, people from the School of Public Health, ABC, for example, Association of Black Cardiologists. I really want to give them a shout out. Because they are an incredible organization. They, along with the National NIH's Heart, Lung, and Blood Institute, created a comprehensive 20 or 12 module curriculum about heart health that's specifically for the African American community. Okay? Guess what? It was sitting in warehouses. So they said, hey, we'll give you this curriculum for free. It's already been done. So that's what I mean about in-kind. It's not always about the money. It's about and resources. So the Smithsonian Institute, they've got wonderful internship programs, but kids from east of the river don't necessarily know about it. They're going to create a Rodham Institute program so that kids can do internships, and even some of them get paid with stipends that will help, you know, allow them to get exposure to things that are right here in the District of Columbia.
We are talking with Dr. El-Bayoumi on the Rock Newman Show from Busboys and Poets in the Langston Hughes Room. I want to let my staff know that we're going to keep this conversation going. This is about healthcare. It's about D.C. healthcare, and I want to sort of really stay with this. I want to ask you, Dr. El-Bayoumi, you bring out a statistic, and all of the statistics that you brought out were, if not alarming, not so much alarming because we are aware of them, but horrific. Here in the nation's capital, we per capita have the #1 rate of incidence of AIDS. How do we change that?
So there is a good news part of this in terms of that statistic, in that, 15, 20 years ago, and by the way, having done my residency training here beginning in 1985, I witnessed firsthand what the AIDS epidemic looked like. And let me tell you, it was not a pretty picture. It was horrible. And I actually was in the rooms of several, it used to be mostly gay men, who died estranged from their families. I was the only one in there with them. So it was horrible. And
Estranged from their families, because especially at that time, there was a stigma associated, which literally made you a pariah. It was leprosy.
Exactly. And what has happened, the good news, is that because of social activism, because of commitment by fantastic clinicians, public health people, regular citizens, AIDS and how HIV has been taken care of in the District of Columbia, there's a lot of good news. We have one of the highest testing of people with HIV. The problem is that once people test positive, only 1 out of 5 gets to undetectable viral load, because there are many barriers to staying in care. And what are they? We talked about poverty. If you have substance abuse, if you have mental health issues, domestic violence, you're working 3 jobs and can't get the 3 buses to get to where you need to go, the person who checks you in is rude, and you say, I'm not going to be bothered. There are so many barriers.
So you say that 1 out of 5, so 20% of those that are now detected with AIDS, I mean, because this is part of a good news story, a bit, that 20% now are treated in a way that that AIDS is no longer detectable.
The virus.
The virus
is not detectable. That's right. The good news part is that we test a lot of people. The bad news part is not everybody's at undetectable viral load.
Yeah.
And I should give a shout out to Whitman Walker, because their undetectable viral load of the people that they take care of is higher than the NIH. Something like 75% of their people.
At Whitman Walker.
That's what holistic, excellent care with committed people looks like.
So in other words, are you saying 75% of those that go through Whitman
Walker have
go through Whitman Walker,
who are HIV positive,
yes,
have undetectable viral load? Because not only do they take care of them in terms of their medical problems, they also have substance abuse, mental health clinics, dental clinics. I should tell you, I'm on the board of Whitman Walker. I don't get any money or anything like that.
Yeah.
But it is that holistic way of treating people that really makes a difference.
Seems that would be a model for the nation, whatever it is that Whitman Walker is doing.
They're doing great work. But the other good news part of it is that committed physicians created a consortium, an HIV consortium of about 156 people. All the AIDS doctors in D.C. got together so that they can say, okay, what can we do collectively? How can we research this problem? How can we make sure that treatment is getting to the people that we want? So they've developed an infrastructure which has worked well, where they share information. Are we as effective as we could be? Absolutely not. But at least there's the infrastructure has been built. The problem in the District of Columbia is you've got a lot of hospitals, but we don't communicate with each other. We don't use the same electronic medical record. So if an individual goes to, let's say, Washington Hospital Center with a problem with HIV and is hospitalized, and a week later goes to GW or Howard, there's no way of sharing that information. Okay. Furthermore, hospital is just a tip of an iceberg of an overall person's health, a hospitalization.
Right.
So when they get to the hospital, it means that usually something has failed, right? Because if they had primary care, if they had clinics, if they had food, if they had all these other things that make part of a healthy lifestyle, maybe we could have forestalled them getting into the hospital. So there are a lot of other models of good work that's being done, not just in D.C., but in other parts of the country. So there's this guy up in Camden, Dr. Brenner, and he's created something called the Hot Spotters Program.
Camden, New Jersey.
Camden, New Jersey.
Uh-huh.
And he is an emergency medicine doctor, and he found out that, gosh, there are a lot of people, the same people that keep coming out in and out of the emergency department. What's that all about? So what did he do? He traced back where they were coming from, and they found out that these people that were the high utilizers were coming from 2 buildings in the projects. And they were using something like 30-40% of the healthcare costs, because you don't get anybody's attention until you talk about costs and reducing them, let alone the human costs and the price that people pay. So what did he do? He, along with a nurse practitioner, along with a nurse and a community health worker, started to go to those individuals and say, hey, how can we prevent you? What can we do to take care of you? Whether it's getting an air conditioner, whether it's taking care of your alcohol or drug abuse or whatever the issues were. And he was able to show that he could reduce the number of people going to the hospital, but more importantly, give people their lives back.
Yeah.
So we at the Rodham Institute, we've been fortunate to be selected, one of 6 organizations in the country that has been selected to be trained by the Camden Group Hotspotters, so that we can learn from them. As I say, there's a lot of good work that's happening in the city and around the country, but we need to, you know what I say, Rock?
Tell me.
Bad people have given human beings a bad rap. It's time that good people stand up.
Yeah, hallelujah.
And take humanity back.
Hallelujah. Let me ask you before we wrap up here. You look around, you drive around the city, and you see the preponderance of obesity. Now, it's interesting when you talk about how that might relate to poverty. Because people think, well, gee whiz, if you're poor, you must not eat so much. But obesity, it seems to be much more prevalent in sections of the city that are the poorest.
And indeed, when you look at the maps, and if we use red as a color where there's really high obesity in wards 5, 6, 7, and 8, some areas are more than 50%. And we know that that's tied with diabetes, stroke, heart disease, cancer, okay? Plus, what's happened to people who are obese in this country, it's almost like they're re-victimized again, because there's a war on obesity, the war on drugs, and when you have those problems, people feel like you're waging war against them. There's actually been studies showing that obese people get discriminated against by physicians in the medical system. So what has been done, and what are some of the creative programs that have been put in place that are working right now, but we want to expand them? So let me tell you about Wholesome Wave. Wholesome Wave was created by 2 fourth-generation farmers. One of them, Michelle Nishin, the other one, Gus Schumacher. Gus was an undersecretary of agriculture under Clinton. And Michelle had kind of had a crisis in conscience. He was a big restaurateur, very successful chef. And he said, my soul is not being fulfilled. So he began to look at how he could be part of the solution and not contributing to the problem of diabetes, obesity. So they founded this organization called Wholesome Wave, where they convinced the government for people who have food stamp benefits, SNAP, to give them double points for fruits and vegetables. And not only that, they hooked them up with farmers through farmers markets. So here in the city of D.C., there are lots of farmers markets, and if you get a prescription from a clinician, you can get double points for fruits and vegetables. So guess what they found? A reduction in your body mass index with people who use those double points programs. And not only that, it's a work program for farmers. 25% increase in revenue. So the Tea Party-backed governor of South Carolina gave $2 million subsidy to grow that program. DC Greens, fantastic work with schools to have healthy eating, as well as school gardens. Okay, Food and Friends, they've a nonprofit organization since 1985, initially founded to deliver meals for people with HIV/AIDS. They've now expanded to people who are in hospice or who have cancer. They deliver for people who need them, 3 meals a day, 6 days a week. And let me tell you, I've eaten there. The food is fantastic.
Wow.
12,000 people volunteer at that organization.
Yeah.
There are good people. So it's about bringing these good people together so that we can see, oh, you know what? This area in this ward is not being covered. Or you know what? We can do this with you to grow our programs. So a lot of wonderful work, Unity Healthcare doing a lot of great work. But we're not going to be able to keep that good work going if we don't institutionalize it.
Yes, yes.
And part of institutionalizing it, this is where the academic centers come in. Mm-hmm. We need to begin to weave public health education into how we train our clinicians.
Yes.
And that's where the Rodham Institute is going to step in.
And again, such a noble role. Let me ask you, if you look at that crystal ball, do you continue as a practitioner of medicine? Or is it any possibility that you won't have time for that? I
know who I am, and I'm a doctor first and foremost. For me to be able to speak about health issues, it's important that I take care of patients, because that's how I keep it real, and that's how I know what the issues are.
Yeah.
And I get a lot more than I give when I take care of patients.
You know, I've been a proponent since I was a little league coach, really when I was like in college, that if you want to learn something, try to teach it. You know?
Yeah.
So you're going to keep on learning.
Oh, for sure.
By teaching.
And I love my patients.
Yes.
Are you kidding?
Yes,
Those
yes,
are my peeps. How am I going to let them down? No.
And you are our peep. Thank you so very much for being on the Rock Newman Show.
My pleasure.
There's so much more in healthcare that we could talk about. And I'll tell you something, we'd love to have you back on again.
It would be my pleasure, Rock. Thank you for inviting me.
And the next segment coming up, the wonderful youth from the Southeast Tennis and Learning Center who performed just this week at the White House, and now they're going to perform for you here in the Langston Hughes Room at Busboys and Poets on The Rock Newman Show. Be back after these messages.
It's The Rock Newman Show.